Hi, I'm Rosemary Stewart and I'm a Health Promotion Coordinator from the National Health Fund. The National Health Fund is an executive agency and we were established to provide funding for national health care. So I'm here today to tell you how you can benefit from us. Our vision is to reduce the burden on healthcare in Jamaica. And it is sad that if you do not have a chronic illness, you know someone very well that does. So if you do, you understand the burden on our healthcare system, because if you have a chronic illness, you have to take medication every day. However, what a lot of people don't know is that we provide help in two ways. We have an institutional benefit and an individual benefit. Under the institutional benefit, we provide funding for institutions that provide healthcare services in Jamaica. So we do that from the public sector and the private sector side. For the private sector side, what you would need to do is submit your project proposal once it has something to do with healthcare, and a committee will meet and see if it is worthy, and then it will be approved if it is. Under the individual benefits, it's the card that everyone knows. This is where we provide a subsidy for all ages. So regardless of your age, your health, or your income, once you have any of the 15 chronic illnesses that we cover, you can get a card to help you to purchase your medication. Then there's JADEP, which is Jamaica Drugs for the Elderly program. And here I have to pause and say it's not JADEP, it's not JDF, because we have heard all these names. But once you're a resident, 60 years of age and over, you can get a card that will help you to get your medication free of charge. But let me tell you some more about NHF. Why it's great? You pay no monthly premium. A lot of you here in this room today may have private health insurance. And what happens is that every year, just like me, you get a letter that says your premium has increased due to usage. I mean, why would you not use your health card if you are ill? But unfortunately, you have a group plan. So if people in your group have a chronic illness and they use their card every month, it would cause a burden on the system and your usage would increase. So although you have not used your card, other people are using it, and therefore it creates a burden to that insurance company and they will increase your premium. Now with NHF, there's no monthly premium, and we will help you if you are enrolled to purchase your prescription. So when you go to the pharmacy, NHF is the first provider. So the pharmacist would take the maximum they can from your NHF card and apply the balance to your private health insurance card. Therefore, less will be applied to your private card, and it should reduce the burden on that card. And hopefully, your premium will not increase next year. So if your friend has a chronic illness, encourage them to get an NHF card. The illnesses we cover, they are arthritis, asthma, enlarged prostate, breast cancer, diabetes, epilepsy, glaucoma, high cholesterol, hypertension, ischemic heart disease, major depression, prostate cancer, psychosis, rheumatic fever heart disease, and vascular disease. You may be wondering, how much do we help you to pay for your medication? We help you on a significant amount of the cost of your drug. That we do surveys every year to make sure we're on top of things, and the last check we provide between 45% to a high of about 95% of the cost of our drugs, with the highest drugs being covered for cancer. So you know how great of a help that is, right? I personally have a friend that uses the card, and she says every day she couldn't do without it, because 1 month she actually lost her drugs and had to buy it cash, and it really was a huge burden on her pocket. So of course your prescription must be on our drug list, and we'll help you to save on over 1,300 prescription items. You can check if your drug is covered. We actually distribute our individual benefits booklets, and of course an updated list is always on our website. Every time you fill your prescription for the items, we will help you to pay for it. Your card can never run out on you. It is not money that's on your card, it is your condition. So if you go to the pharmacy and the pharmacist tells you that there's no money on your card, you can just ask them to explain exactly what is happening, because we actually do not put money on your card. However, what we do is that we pay the same amount for the active ingredient in the drug. So no matter what brand you buy, the amount we pay is the same. So for example, people who are asthmatic and they use a puff or a pump as Jamaicans call it, Ventolin is a brand because everybody goes to the pharmacy and says they need a Ventolin. But what we actually pay for is the salbutamol, which is the active ingredient in the brand. So any puff that you buy, we're going to pay the same and you pay the balance. So it's in your best interest to speak to your doctor or your pharmacist and tell them what you can afford so that they can recommend the brand that you would like. If you're diabetic and you have an NHF card, we can help you with your diabetic supplies. Because we believe if you can monitor and manage your condition, you will take less medication and therefore reduce the burden again. So we will help you to purchase test strips, lancets, and syringes. The test strips are used to measure your blood and urine sugar levels, lancets to prick your finger and it doesn't hurt, and syringes are needles for people who need to take insulin. However, to use all these things, you would need the machinery. So we'll give you a glucometer free of charge and or an insulin Penfill applicator if you administer insulin. However, these things aren't stored at NHF. What we do is that we partner with the distributors all across the island. So you would need to call us, tell us which one you want. Tell us the brand you want. Unfortunately, an NHF representative can never recommend a brand to you. What we do though is recommend that you speak to your doctor or your pharmacist, especially your pharmacist, because if you are in an area where there's only one pharmacy, you need to know which strips that pharmacy carries, because if you have the machine and you don't have the strips, you cannot use the machine, right? So find out which strips they carry and then you call us. Tell us the brand you want, give us your card number, your name, telephone number. We will contact the distributor and they will arrange with you to have the item delivered. Another thing we help with is the HbA1c benefit. It's now the best measure to check for diabetes. And I'm sure if there's someone diabetic here or if you have had to do a check for diabetes, you understand the stress of doing a test. Of course, the first thing is fasting. And we know Jamaican people like to eat. We don't want to go all night without eating. So we have to not eat all night, go in for our test, wait, have some blood drawn, then have the glucose. And if you have had that drink, you understand how terrible it is. It's an all-day process. With the HbA1c test, there's no fasting. You can have your breakfast, simple finger prick test, 5 minutes, and you know your results, right? Because what the HbA1c test does, it checks your blood glucose level for the past 3 months. So therefore, you cannot trick this test. Unlike a quick test where questions have to be asked, no questions are asked for the HbA1c test, and it gives you an accurate result. Another way that we help is that we give respiratory devices. If you have a small child with asthma, we recommend that you use an asthmatic spacer and mask so that all the medicine is administered properly for the child. Think about it. A baby does not understand to hold that puff in your mouth and breathe it in properly through their lungs. If they have a spacer and a mask, all you have to do is use the puff, they breathe it in, and they get all the medicine. And that's another way we reduce the burden. So after hearing all this lovely stuff, how do you apply for your card? We have a yellow NHF card application form. You complete Section A, which requires your name, age, date of birth, mailing address, and TRN. Each member of the family has to do their own form, and each person has to have their own TRN. So even children, you have to get a TRN for your child. Section C of the form is completed by your doctor, and that is where your doctor will indicate your illness. Application forms are available at our head office, that's 25 Dominica Drive. We also have NHF customer care desks located at Cornwall Regional, St. Anne's Bay, and Mandeville hospitals. Usually our forms are also at any hospital, pharmacy, doctor's office. They are everywhere. And usually if we come out for a presentation, we bring them with us. As I said before, ensure your TRN is correct. right? And if you use your TRN on your child's form, the form will be rejected. So please get your child's TRN. Make sure your mailing address is correct because we mail the card back to you in 2 to 3 weeks. You can then use your card at a participating public or private pharmacy, and you must sign the drug bill at the pharmacy. If you already have an NHF card and you need to add another condition, change your name or address, or replace a lost or damaged card, you need to fill out an NHF Change Form. It is a blue form, and if you're adding a condition or illness, you need to take it to your doctor for them to add the condition. However, if you have lost your card, had it damaged or anything like that, you do not need to take this form to a doctor. You just fill out section A and our customer care representatives will be happy to replace your card. It will be mailed to you in a week. For JADEP. JADEP provides certain drugs free of charge for people 60 years of age and over. However, you are required to pay $40 per item to the pharmacist. This is an administrative fee that they charge for dispensing the drug. However, you cannot pay more than $240 at any one time for JADEP drugs. JADEP enrollment is self-reporting. What that means is that no doctor's certificate is required. However, you do need to prove your age. Therefore, you need to provide your birth certificate, passport, driver's license, senior citizen's ID, or a letter from a JP, medical doctor, or pastor. However, if you are providing a letter, that person has to state your date of birth in the letter to verify your age. You can be enrolled for JADEP at any of our offices or at the outreach events that we are at, and it's a pink form. JADEP card is the same as NHF card. The only difference is that the word JADEP is on it. And the illnesses covered are arthritis, asthma, enlarged prostate, heart disease, diabetes, glaucoma, high cholesterol, hypertension, psychotic conditions, vascular or circulatory problems. Once you have a JADEP card, we encourage you to get an NHF card as well. So if you do not have a TRN, we'd encourage you to get your TRN and get an NHF card. The reason being, JADEP only covers 10 conditions with 70 items with monthly supply limits. That means the NHF is telling you how much drugs you can get for the month. With NHF card though, it covers 15 conditions with over 1,300 items according to your needs. So depending on what your doctor has prescribed, that is what you will get. So for example, your arthritis, you have arthritis, and you take 2 tablets a day for your arthritis. That means you will take 60 tablets a month. Under JADEP, you would only get 30 tablets for that month. Therefore, halfway through the month, your tablets will be finished and you would need to purchase some more. This is where the NHF card would chip in to provide a subsidy for the balance of the drugs. If you did not have an NHF card, you'd have to find that money out of pocket. These are the ways that the National Health Fund helps reduce the burden on healthcare in Jamaica. If you have any further questions, please call us at 906-1106 or visit our website nhf.org.jm. Please like us on Facebook, follow us on Twitter, or look at our videos at youtube.com/NHF Jamaica. The National Health Fund, we're taking a healthy interest in you.